So James, and I would now like to highlight a little bit, we talked about how so much has changed in the past couple of years, and it's really hard to keep up with that for us, much less, the community that's not in it every day. So if you could just provide an update on the most recent vaccine recommendations. We'll start there, and then next I'd like to just review sort of if you do get COVID, people are still getting COVID, what kind of treatments are available to you and how you can access them.
Sure. So the most current up-to-date vaccine recommendations, we obviously in the United States we have three vaccine options. You have Pfizer, Moderna, and Johnson thank you. The mRNA vaccines are really the preferred as of now based on the studies, and so that would be Pfizer and Moderna. And those are currently 2-dose series, and they do have a pediatric formulation available for 5 to 11-year-olds for the Pfizer, and then 12 to 17 is available for Pfizer as well. The Moderna is available for 18 and over. And then right now you are also available, there is a recommendation to get a booster up to 4 months after your series is complete. If you are immunocompromised, there is a recommendation to get a third dose that is not considered the booster. And then they just recently came out with an additional booster that can be given to those patients who are over 50 or patients who are immunocompromised. And so that's really where we're at with the vaccines right now. They want you to have that complete series and then one booster to be up to date. And then there is that recommendation for the additional booster if you meet those two criteria, being over 50 or immunocompromised. And so, those can be given. Most retail pharmacies now have supply. You can get it from your physician's office. I know from St. Bernard's standpoint, we do have it at our First Cares at the Matthews, the Parker Road, and the Red Wolf all have them. And then also the Internal Medicine Residency Clinic has them as well.
Okay.
Now, if you do test positive for COVID and you're looking for treatment options, currently the first line treatment is the oral therapy Paxlovid. That's the first line. If for some reason that is not an option for you, then remdesivir is the second line treatment, which is a 5-day injection. So you would have to, that would have to be set up with the hospital or an outpatient infusion center, and you would have to come back 5 days consecutively. Those are the first first and second line options. If those are not available, there is a new monoclonal antibody, Bebtelovimab, which is just recently come out. And then molnupiravir is the other oral treatment as well. And so those are our treatments.
I really just wanted James to have to say all those words.
Yeah, I appreciate that. And I don't even have them written down in front of me.
I'm impressed.
Yeah. And then I did forget, if you are not able to get the COVID vaccines because you're allergic to them, they have, in the last few months, come out with a pre-prophylaxis treatment option called EvuShield. And so that's geared towards people who, for one reason or another, won't mount an adequate immune response to the vaccines. So people who are severely immunocompromised, or for people who've had an allergic reaction to the vaccine. And so that is an option for prevention as well.
Okay, thank you. One key point too, so the goal of those treatments is to try to keep you from getting really sick and to keep you out of the hospital. So it's really important for people to get that treatment very early, right?
Right, yes. So for the oral, within 5 days of symptom onset, and for the 2 monoclonal antibody, or for the IVs, it's within 7 days of onset of symptoms.
Right.
So yeah, it's very, very important that if you feel like you have COVID, you have those symptoms, you need to get in, see the provider, get tested, because that you really have to work through them to get set up. And there is limited distribution of all of those currently.
Okay.
Even still,
yeah, just with who has it, especially the oral treatments, what pharmacies have them available.
how's our region doing?
Our region's doing pretty good. I mean, we have plenty of stock right now, based on the fact that the numbers have gone down. But there is still, I think, only 3 or 4 pharmacies in the region that do carry them.